A doctor from UAB shares the risk pregnant mothers and their babies could experience if they contract a severe case of COVID-19. Dr. Jody Odom says the biggest risk for expectant mothers and their babies is decreased lung volume, and as the baby continues to grow, making it hard for the mother to breathe. She believes this especially happens in the second and third trimester of the pregnancy.
We know that healthy babies come from healthy moms. So if the mom isn't healthy and isn't getting good oxygen and isn't breathing well, that's also bad for the baby. On the other hand, if we can prevent mom from having low oxygen levels, if we can keep her oxygenation normal, that's going to be the best possible situation. And the way to create that is through vaccination.
She says it's safe to get any COVID vaccine that's available.